Hi everyone, I am Dr. C Misra. I am the head of critical care unit at Care Hospital, Banjara Hills. Today we are going to discuss about a devil called alcohol. Everybody knows nowadays. I think it is the younger generation, even the people who are 10 years old, 12 years old also know about alcohol, and lot of people they start taking alcohol at much younger age group compared to ours when we used to be there and younger at our young age. Alcohol as a devil have many names. Let's see, people call it to be Madira, Somras, and in local terminology there are many. Like you see, it is Kallu, Sara, and uh, and if you see these are country liquor, and if you see different that what we see as whiskey, vodka, lot of things are there. There are many myths and there are many things that we supposed to know when it comes to alcohol as a common man, when we should act, when what we are supposed to do in a patient if somebody is taking alcohol or your near and dear somebody is taking alcohol also, what we are supposed to know about alcohol and alcohol related issues, what we can see in a patient who is a chronic alcoholic or started alcohol recently. To discuss all those things, we have Dr. Akash Chaudhary, is our senior medical gastroenterologist at Care Hospital. So he has vast experience of more than 25 years. So he will be the right person to discuss all these questions, whatever we have. It will be more of formal. We'll be discussing each other regarding maybe alcohol related issues, what commonly we see, and maybe in ICU related things also we'll discuss. To start with Akash sir, maybe I think we should start with the myth busters. So that is a common, I think people they have a misconception that if you take very less alcohol, usually doesn't cause much of problem. And of late, actually, if you see, even there are some medical literature which was published some time back, when they have seen moderate quantity of alcohol intake improves your heart, cardiac wise, they have a better outcome. The chances of having MI and all are less. What do you say about that, sir? Is there anything like that?
As you said, sir, I still feel that it's a myth only, and there is no safe dose of alcohol. So depending on your genetics, your body makeup, your environment, your mental status, even some people who consume the least amount of alcohol, they can also develop complications like pancreatitis, hepatitis, and severe gastritis, severe reflux. So there is no safe dose of alcohol which you can take.
Is there any particular dose where we should think like it is not good or beyond that it is going to harm us?
See sir, many people who take alcohol and they are not taking it very frequently, the most dangerous part is binge drinking. So binge drinking is for men it is around more than 5 pegs, and that is 1 unit. 1 unit is around 30 ml of alcohol, which contains 10 grams of alcohol. And if you take more than 5 units per day or more than 15 in a week, that is called binge drinking and can be very dangerous.
So there is, let's say, may not be the myth. We all know we don't know. See, first of all, alcohol is not the only thing which causes liver problem, but alcohol most of the time is associated with liver issues. But initially, see, liver gives us lot of time. If somebody is a chronic alcoholic also, it gives enough time. Till that time, it is reversible. If somebody who is a chronic alcoholic or taking alcohol for years together, if they stop alcohol, that liver dysfunction comes back to a normalcy. But is there any time frame or when it comes to quantity and duration, if somebody takes alcohol?
See, as I'm telling you, sir, it's all genetically related and your eating habits and all that. But normally there are different stages of liver disease which can happen. It can start with the simple fatty liver, which reverses if you stop alcohol for 3 to 6 weeks, early fatty liver, alcoholic fatty liver. Then the second stage comes is that if you've been consuming for a longer time, then the patient can have hepatitis, that is called alcoholic hepatitis. Normally it takes around 6 to 12 months for the hepatitis to reverse, and then again you go into fibrosis. Fibrosis of liver can be early fibrosis or late fibrosis, that the liver architecture has started to go bad, that is fibrotic tissue is developing there, and partial cases it can be reversible, but once when you cross fibrosis and it enters into cirrhotic liver, then it becomes irreversible. and then the complications start.
So basically the liver shrinkens.
The liver initially
Liver
it will become
shrinkens.
big, then it becomes smaller, and you develop portal hypertension, then you develop all the complications of liver disease.
Liver disease, which is one of the most common cause of any chronic alcoholic patient coming to our ICU because of this chronic liver disease or cirrhosis getting decompensated. Decompensated means they will have multiple organ involvement. Let it be your brain, your kidney, your lungs, you name it, any organ can get affected. They can bleed to death also. So, like sir, coming to like when it comes to alcohol and alcohol related issues, most of the people they believe if somebody is taking alcohol, it affects only liver. So what all other things when it comes to medical gastroenterology,
Sir.
you believe a alcohol who is taking maybe a chronic alcoholic or regular alcohol can cause different organ which are getting involved?
Yes, sir. It can involve the GIT. It can involve the pancreas. They can in GIT they can develop severe reflux. They can develop ulcers. Then gastritis, alcoholic gastritis after binge alcohol drink. Then long-standing or even few drinks can lead to acute pancreatitis, which can be complicated. And then recurrent episodes can lead to chronic pancreatitis, which can even lead to malignancies. Then the liver we have already discussed. Then other organs that can be cause malignancy of the throat and the pancreas and the liver. If it's an end-stage liver disease, then you can have cardiomyopathy.
Even
Yes,
breast
sir.
cancer has been
Yes,
attributed
breast
to
cancer has
alcohol.
also been attributed, and then you can have alcoholic cardiomyopathy with arrhythmias. They can come with seizures. Then dementia sets in, then
Early.
cerebral ataxias in these people. So these are very common. So what I wanted to ask you, sir, what are the emergencies you are seeing in ICU, and what hurdles are you facing in managing these patients?
See, very important question per se. See, this question have such a big horizon.
Yes, sir.
It becomes very difficult to answer pinpoint. You see, from starting from alcohol related road traffic accident is very common. See, somebody who is in the influence of alcohol, having a road traffic accident and having severe road traffic accident causing maybe severe brain injury and all are very common. So we see a lot of cases of traumatic brain injury where significant brain and other organ or maybe bone fractures and all are very common in people who are driving mostly two-wheelers, even four-wheelers under the influence of alcohol. So we see a lot of cases, first trauma cases because of alcohol. Apart from they will have a lot of issues in family, that's a different thing altogether. We are not going to discuss about socio-economic status of a patient who is a chronic alcoholic. Other than that, the next thing what we see is somebody who is chronic alcoholic, if they stop alcohol for 3 to 4 days also, they'll end up in a thing called alcohol withdrawal, and these people will be very irritable. They may become kind of very drowsy also. Sometimes they present to us with multiple episodes of seizure or fits, what we see in regular terminologies. So these are not uncommon. So these are basic presentation apart from I think gastritis and all you have discussed. Even we have seen people after a binge alcohol coming with irregular heart rhythm called atrial fibrillation, where the heart rate may go up to 150, 200 also. Usually benign, most of the time it settles down by itself, doesn't require much of attention. These are maybe, apart from the traumatic brain injury and all, the other things are mostly not that serious where they'll end up in ICU, but seizures and all, they still come to ICU till we control them. But major problems what we see with alcohol related issues are related to liver only.
Yes.
If somebody is developed severe alcoholic hepatitis or chronic liver disease, they get decompensated. So they have very low threshold to maintain their livelihood in a normalcy. So with a small infection, maybe a little fluid in the abdomen, they may have a little bleeding tendency will increase, they may bleed. And even a small change in their livelihood or small change in their common general condition, they'll end up in a much bigger problem. And within no time, they'll end up in multiple organ involvement. If you see in a liver disease patient, a chronic liver disease patient, during the decompensation, almost every organ get affected. To start with the brain, sometimes they present with coma. And this is called hepatic encephalopathy, where serum ammonia is one of the things what we look at. If it is very high, we believe it is encephalopathy. They can have seizures because of that. And the brain inside pressure also may go significantly high. Then second thing, their heart we have discussed, these people can develop cardiac issues, cardiomyopathy and all. liver dysfunction give rise to their protein will be low. They will have lot of fluid accumulation in the abdomen
Ascites,
because of
yes.
low protein and portal hypertension, which is a consequence of your liver disease.
Right.
Then they will have coagulopathy, means bleeding tendency will be so high they can bleed from anywhere and
Yeah,
everywhere.
a lot of cases we see they have esophageal varices where
Esophageal
we have to do
varices.
endoscopy and do
And this
banding and
esophageal
endotherapy.
varicose people can bleed to
Yes,
death
sir.
also.
Yes,
Maybe
sir.
liters of blood can
Right,
they
yes.
can have bleeding within no time. So kidney injury, we call it to be
Hepatorenal syndrome,
hepatorenal syndrome.
hepatopulmonary
Their lungs
syndrome,
can get affected,
hepatopulmonary
hepatopulmonary. So
syndrome.
this in a patient who is having alcohol-related liver injury, that too in advanced stage called cirrhosis, if they come to our ICU in a decompensated state, we'll never know how they will behave and how many organs are going to be affected, and their mortality is very high.
Very high.
So this is what we see. We lose a lot of patients with when they come with chronic liver disease,
Yes,
decompensated with multiple organ dysfunction. So if you coming back to some of the basics, there are few local alcohols like Kallu, Sara and all. Do you have any idea? Like people that drink that because we don't have any idea what is the amount of alcohol in those.
What is there? What are the material they are mixing? What spirits are being mixed? That has to be taken care of.
Because what I have seen many people who take this country liquor like Kallu, Sara and all, they are mainly adulterated with many other medicines, mostly the
Spirits, yes.
diazepams and all, which are very, very highly sedatives, and the amount what they had also nobody knows.
We don't know.
So people, they come after taking Kallu and Sara almost obtunded, they will be in a coma kind of state requiring ventilation and all. So these are all dangerous. So I think the most important myth is no alcohol is safe.
No alcohol.
Amount is safe.
No amount is safe.
I think the two most thing what we need to look at when it comes to alcohol is, if you are not taking alcohol, don't take
start.
It. If you are taking, then start decreasing and stop as early as possible.
And keep yourself updated. Get your investigations done. Get a liver function done, test done. Get a ultrasound abdomen done to see that there are no changes of early liver disease which are coming.
Thank you very much, sir.
Thank you,
I
sir.
think
Thank you.
we had some important information for the common public, apart from the myths what I think a lot of people are having that need to be busted. So thank you very much.
Thank you.